Okay, everyone, so, I think this is going to be a great video for a lot of great reasons. Dr. Wagner, what exactly do you do at Doctors of Podiatry? And what I've assembled here is some of the procedures that we perform here using whether it be minimally invasive techniques or the open traditional approach, the surgical approach. So, I think the goal of this video is to kind of just briefly talk a little bit about each one of these procedures, and that will bring a little light to everyone in respect to what we do here at Doctors of Podiatry. Number one, toe shortening. Number two, toe lengthening. Bunion deformities. Number four, hammer toes. Ugly corns, what we call the side tucks as well as the toe tucks. These are soft tissue procedures. The Haglund's, the notorious Haglund's deformity, Haglund's syndrome. Anything in respect to, this is a very broad term, heel pain, that can be posterior heel pain or plantar heel pain, also known as plantar fasciitis. Also for the correction of flexible flat feet, the high flexure procedure. And I put here, last but not least, the sky's the limit. If you can think it, we can most likely accomplish it. So what we're going to go ahead and do is we'll do a little show and tell. We'll kind of briefly talk about each subject and the approach. And I think that, it'll definitely help people understand a little bit better about Dr. Wagner. What exactly do you guys do there? Step by. Toe shortening, subject number one. A lot of people battle these long toes. We historically see second, third, and or fourth toes that are, very long. Even the first, believe it or not, the big toe. A lot of people have big toes, the great toe. And then the second, third, fourth, and fifth toes are very, very short. So not all feet are created equal. We do see different clinical presentations in that respect. So we address every case accordingly. We just so happen to have the individual with that's helping us out here today. This individual has, for example, the Morn's toe. As everyone can see, he has a very long toes, the long second toe. So this is a perfect show and tell. So again, a lot of people that have been battling long toes, they're not happy with the appearance, number one. Number two, the social elements, self-esteem, embarrassment. They're just not happy showing their feet. It's very important to understand those elements. Makes things a whole lot easier for patient and for the entire team. So in respect to the toe shortening, we do these, and I'm going to talk a little bit more about toe shortening than anything else, just because we do a lot of toe shortening procedures here. We have basically refined, pioneered these minimally invasive techniques. Using, for the correction of these deformities. We put one little suture here, sometimes on this side, right around here as well. We hide everything. It's a two suture technique. And basically what we do is we just shorten the toe, right? So we recreate that real nice parabola, kind of like that. And we reestablish the quote unquote the rainbow. Same thing goes for the big toe. We are able to either shorten number one, number two, number three, number four, and even today, this morning, we did a number five, actually. They're pretty rare, but this was a very atypical case, and we'll talk about more of that case a little bit on the toe lengthening. So number one, number two, number three, number four, same thing. One little suture here, 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 either here, here. So when you look at the foot from, this view here, you don't see absolutely anything. And then, of course, we don't use any pin screws or plates. Everything's done under local anesthesia. And this what I'm telling everyone now, it applies to all the procedures here. Anything that we do here in the office-based surgical suite, local anesthesia, patient is awake, patient walks in, walks out. Okay. Procedure number two, lengthening of the toes. Yes, we do see something that's called, very commonly seen, brachymetatarsia. In simple terms, if and I would definitely, for the people out there that are battling short toes, I would definitely Google brachymetatarsia. That could be the source of the clinical presentation. Short toes could be as a result of two things: a congenital, which means that you were born with it, congenital short toe, and the metatarsals are okay. The metatarsals are these bones right here. Okay, these are fine. Or the metatarsals are short. One of them could be it could be left and right foot as well. When the metatarsal is short, it's called brachymetatarsia, thus making the, in this case, the fourth here would make the toe shorter. And then the congenital short toe is the metatarsal is perfectly fine, and then the deformity or the problem is either in this bone or this bone. Okay. So if it's breaking metatarsia, we can address these issues using either, you know, what we call callus distraction, a little gadget that goes on top of the foot for a lengthy period of time, and or also the implementation of a bone graft. So, you know, these, no one likes these two procedures for a lot of obvious reasons. No one likes to see a little gadget stuck on their foot. Doesn't look good. It's a little bit, I would say, a little bit scary for some of the patients. But does it work? It does. In the right hands, right, the clinician, if done correctly, it works very, very well. And then, of course, we use these also the implant, the spacer implants, which work very, very well as well. Again, same thing, depending on the clinical presentation, number one, and number two, in the hands of the right clinician surgeon, making sure that the clinical outcome is to the highest standards of the care. So that takes care of that. And those, I want to be very clear, those procedures are open traditional, right? There's no way that we can put an implant in the toe and or the foot through one little suture, or a keyhole incision for that matter. Number three, we'll kind of combine the bunions and hammer toes. The bunions and hammer toes we perform using our minimally invasive techniques. We'll make believe this is kind of like a bunion, kind of like that. One suture here, and one suture right here. Again, 1, 2, and 3 sutures, not the open traditional. I want to be very clear with everyone. You know, when I did my training, I did train using the open traditional technique. I do not have a problem with open traditional. This is just another technique of how to accomplish a desired final clinical outcome, okay, in the correction of these structural deformities, whether it be the hammer toe and or the bunions. So again, one here, one here, one here. We're able to do several procedures. Patient walks in, walks out, local anesthesia, office space surgical suite, no pins, screws or plates. Let's make believe this is a hammer toe or multiple hammer toes, kind of like that. Same thing. Sometimes we will have one little suture here, one underneath the toes, and each toe separately, depending on, again, not all hammer toes are created equal, whether it's something flexible, semi-rigid, or rigid, that will dictate what procedures we perform. But all in all, you know, what's important is that we're able to correct these, oh, check it, look at this, look what we got there. Ooh. Not good. Anyways, so we'll go ahead and implement these minimally invasive techniques. And the nice thing is, you know, we essentially hide all the little incisions. No pins, screws, or plates. Same, again, like I said before, everything applies across the board. Let's continue. The ugly corns, we'll categorize, we'll start with the ugly corns. Ugly corns, depending on the clinical presentation, sometimes it's a one suture, one stitch technique where we address the structural deformity, whether it's a little bone spur that's causing the lesion, the unsightly lesion. Yes, that is a one suture technique versus what I like to call plucking or removing these ugly corns. We'll make believe that this is an ugly corn right there. That's a perfect clinical scenario there. And then what we'll do is we'll actually pluck this little guy out and, you know, make sure, you know, we'll make sure that the closure is very, very nice. And as everyone can see, you have some, you know, you have these little wrinkles that run from left to right or right to left. We try to hide that incision, you know, 3 little sutures here and or here, and we try to hide those in the little wrinkles, okay? But a lot of people battle these ugly, unsightly corns. A lot of people, what leads to the development of these really, really ugly, robust, kind of like these corns are coming at you. The implementation of these over-the-counter remedies that they sell in you know, pharmacies and supermarkets and so on and so forth, they do have an acid. No one really reads the instructions and or ingredients primarily, and these ingredients are caustic. They actually burn the skin. When the acid burns the skin, depending on the skin type, that will lead to the, you know, to the visualization, whether it's something hypopigmented or hyperpigmented, both of which are essentially ugly, okay? So that takes care of the corns. So let's talk a little bit about, you know, slenderizing of feet, removal of any fatty adipose tissue that makes feet look not very pretty. So in respect to, and this is great. We really have the whole Monty here, the full Monty. So we have all this for people that come, here to, interested in maybe, making the foot thinner, prettier. Usually, historically, whether it be the big toe, also the lesser toes, And this is, again, yet another, perfect example. We do have a little bit of fat here. Sometimes people with the Morton's toe, long toes, they put a lot of pressure on the sides of the toe at the tip. So what we're able to do is actually kind of do this, right? It's kind of like a tummy tuck, but for the toe. So we're able to remove the adipose tissue, the fatty tissue on both sides. Also, we do see this a lot. And the big toe, we see it a lot, kind of like that, right? And no one likes to see kind of like that little lump or that collection of fatty tissue. So we kind of go bloop, and then we're able to recreate that. So again, the toe tucks, and then of course the side tuck, same thing. A lot of people come, there's a lot of, these people have a lot of fatty tissue here, and we're able to actually just, take a little slither of tissue here and make it look really, really nice, kind of like that, right? So that's the side tuck, toe tucks, all soft tissue. Let's continue now in respect to heel pain. Obviously, heel pain, plantar fasciitis, inflammation of the longest ligament of the foot, very, very painful. A lot of people, for the people that have exhausted all the conservative measures, there are minimally invasive alternatives, whether it be low-level shockwave therapy, which we perform here, anything that has to do with either stem cell therapy, PRP therapy, any type of regenerative medicine, which applies also to the back of the heel, and last but not least, any type of minimally invasive procedures. Okay, for the heel, and then Haglund's, which applies to the back of the heel, is that what they historically call the pump bump. It's an inflammation of the Achilles tendon, degeneration as well in this area here, and after we carefully evaluate every patient that comes in with pain on the posterior aspect here in the calcaneus, okay, we're able to address this. Historically, and there's nothing wrong with the open traditional, making sure that some people like to detach the tendon, then address the bony deformity, and then reattach the tendon. A lot of people do that as well, depending on the clinical presentation. Not all the surgeons perform these procedures the same way, and that's perfectly fine. So what we basically do here is, through the other side of the foot here, we make two little incisions, and we're able to address everything accordingly here. Okay, so for people that battle this problem, a lot of athletes, and also non-athletes, people that are ballet dancers, performing arts, etc. A lot of people battle these issues. So we can definitely take care of that as well. And last but not least, the flexible flat foot, people with flexible flat feet, ranging from the adolescent stages up, we'll say the adult stages as well. It's called a Hypercure procedure. It's Hypercure. I mean, it's for all intents and purposes, I call it, I would categorize it as more of a hybrid procedure in respect to whether it's one stitch. No, it's 3 little sutures. We make a little incision here, and we place this tiny little peg in between the calcaneus and the talus, which is this right in there, right in here, between this bone and this bone here, right in here in that little tunnel there. We place a little peg, and the purpose of the peg, in simple terms, is to, if people's ankles are rolling inwards, right, we want to bring them back to a more normal position, and that's exactly what the peg does. Okay, so that's the Hypercure. So all in all, I think this video will give a lot of people at least a better idea of what procedures, Dr. Wagner, do you actually perform there at Johns Podiatry? Okay, so in respect to the downtime, like I said before, everything's done office-based surgical suite, local anesthesia. Patients walk in, walk out, and they're using a pair of ugly shoes. They're not Gucci nor Prada for that matter. So people, what they, for patients that come here for surgery, they leave the same day. People from out of town, if they're staying in the area, they'll go back to their hotels or their Airbnbs, and they'll be back here 2 days after the procedure, maybe sometimes 3. They'll stay here locally in South Florida, and then they will go back to the respective homes. And the same thing goes for people that are here locally in South Florida. Once patients come back, we basically address everything, making sure that everything is a-okay. And during the course of the next several weeks, once a week, we definitely see patients here that are local. And for the patients that come from out of town, we have virtual teleconsultations. Everything is streamlined from A to Z, so that patients don't have to worry, right? We don't want patients worrying about anything in respect to the recovery process. And then eventually physical therapy as well, if needed. We go ahead and implement that as well. So this is really kind of like that Cliff Note version concise, explanation of some of the things that we do here. I may have not covered everything in its entirety, but if you guys have any questions, please feel free to reach out. We're very approachable, number one. Number two, we try to answer every single question that people ask us on any of our social media platforms, whether it's our YouTube page, our Instagram page, or our Facebook page. Jaws Podiatry, all of the above. So I think that, and one of the last things that, I put here at the end, the sky's the limit. People come here from out of town. People are very crafty. They think about, only the patient, the human being can actually look at their feet and maybe see something that they're not happy with. For people that are not happy with, their feet, or they see something that they don't like, we're open to the idea of, right? It may be feasible, it may not be feasible. So my point is that if you can essentially think it, we can try to accomplish it. But I would say 9 times out of 10 we can. Again, within reason, right? So I think this has been a great video for a lot of great reasons. We covered a lot of the clinical presentations that we see here. We continue to refine these minimally invasive techniques. A lot of people, I think, not necessarily that newer is better. Minimally invasive techniques have been around for a very, very long time. Predecessors have really gone above and beyond to really, pioneer these techniques, which, a lot of surgeons, I think, are embracing these techniques for obvious reasons. Again, newer is not always better. You have the open traditional, you have the minimally invasive. Both accomplish the final, what's really, really relevant and important, the final clinical outcome. So I think it's, this has been long overdue, a video as such. We continue to post a lot of before and afters. I highly recommend everyone out there, take a look at all the before and afters. Really, really important. There's might sound a little bit cliche, but yes, a picture does speak many words. We will continue to do what we do, which is this education at the core of what we do, to educate the world that these minimally invasive anesthetic and cosmetic foot and ankle procedures do exist. For all the people out there that are not happy with their feet, number one. Number two, that they're insecure, self-esteem issues, conscious, don't want to wear sandals, open-toed shoes, there are solutions. Know that. And if you guys can take, or some people can, take that message, I'm a happy camper right now, okay? And last but not least, like I said before, we will continue to do what we do. We're gonna continue to educate the world on that all of these minimally invasive procedures do exist. Thank you for watching. Oh boy, he's getting, we'll talk about that later. We can accomplish everything on your foot too, don't worry about it. So, not as easy. Go.